Welcome to the deep dive. Today we're really focusing on a health issue that, well, if you own a large dog, you'll definitely want to understand. Yeah. Elbow dysplasia.
Exactly. Yeah, we're diving into a detailed veterinary source today. Our goal really is to break down this pretty common problem, give you the essential facts, without drowning you in medical jargon, because knowing about potential health issues is just so important for any dog lover.
Right. So elbow dysplasia. It sounds like one thing, but our source says it's more complex, like a group of issues.
That's exactly. It's not just one condition. Think of it as an umbrella term for four different developmental problems.
Four. Okay.
Yeah, four specific abnormalities in how the elbow joint forms. And they can show up alone or sometimes, often actually, in combination.
And it can be in both elbows?
Yep, happens in both elbows bilaterally, they call it, in about 50% of cases. So half the time it's affecting both front legs.
Okay, let's dig into those four then. What's the first one?
So the first is ulnar and conial process, UAP for short.
UEP. Got it.
Basically, there's a little piece of bone on the ulna, one of the forearm bones, that's supposed to fuse, like lock into place by about 5 months old.
Okay.
In UAP, that fusion is delayed or just doesn't happen. And the thinking is maybe it's due to like abnormal stress on that growth plate during development. It leads to instability.
Huh. So a piece that doesn't connect right makes sense. What's number two?
Number two is osteochondritis dissecans, OCD. Not the mental health condition, obviously.
Right, different OCD.
Yeah. This one affects the cartilage on the inner side of the humerus, the upper arm bone, right in the elbow joint.
Okay.
So the cartilage development goes a bit wrong. It doesn't turn properly into bone. And you can end up with this sort of flap of cartilage peeling away.
Ooh, a loose flap. That sounds like it would definitely cause irritation.
It does. It can cause pain and inflammation inside the joint.
Okay, what's the third one?
The third is fragmented medial coronoid process, or FMCP.
FMCP.
This involves a tiny part of the ulna, again, that lower arm bone, specifically the medial coronoid process.
Right.
It can develop fissures, like little cracks, or even completely break off, forming fragments within the joint. It seems to be a sort of developmental weak spot in the bone or cartilage in that specific area.
So we've had a connection issue, a cartilage flap, and now fragments. What's the last one? Number four?
The last one is elbow incongruity.
Incongruity.
Yeah, it just means the joint doesn't fit together perfectly. Usually it's because the two bones of the forearm, the radius and ulna, haven't grown at quite the same rate.
Oh, so they're mismatched.
Exactly. One might be slightly longer or shorter, leading to uneven pressure and wear inside the joint. The source also mentions the shape of the joint surface on the ulna, the trochlear arch, might be malformed, so it doesn't articulate smoothly with the humerus, like gears not meshing quite right.
Wow. Okay, so those four things, UAP, OCD, FMCP, and incongruity, that's elbow dysplasia.
Yeah.
Why is this such a big deal for dogs? What system does it hit? And, I mean, how common are we talking?
Well, unsurprisingly, it hits the musculoskeletal system. Bones, joints.
Makes sense.
And its impact is huge. Our source flat out states it's the most common cause of elbow pain and lameness in dogs.
The most common, really.
Yep. And a leading cause of front leg lameness overall, especially, as you mentioned, in those large and giant breeds. So if your big dog starts limping on a front leg, this has got to be high on the list of possibilities.
That definitely puts it into perspective. And you mentioned genetics earlier. Is it strongly inherited?
Very much so. The heritability index is cited as being between 0.25 and 0.45, which means genetics plays a really significant role. It's not the only factor, but it's a major predisposition. If the parents have it, the pups are much more likely to develop it.
Okay, so which breeds should owners be most aware of? You mentioned large and giant breeds.
Yeah, the list is pretty long, unfortunately, and includes some really popular dogs. Think Labradors, Rottweilers, Golden Retrievers, German Shepherds.
Wow.
Bernese Mountain Dogs, Chow Chows, Beardies, Newfoundlands. It's quite a few of the breeds people love.
Definitely. So if you have one of these breeds, or you're thinking about getting one, this is something to know about. When do the signs usually start appearing?
Typically, the lameness or stiffness starts showing up when they're young, usually between, say, 4 and 10 months old.
Okay, so still puppies, really.
Yeah, young dogs. And diagnosis often happens between 4 and 18 months. But, and this is important, the joint degeneration it causes can lead to symptoms later in life, too, even if they seemed fine as pups.
Ah, so it can show up later as arthritis, essentially.
Exactly. And there's a note that males might be slightly more prone to FMCP. That fragmented process.
And interesting. So what are the owners actually seeing? What are those classic signs?
The main thing is lameness. It might be subtle, maybe just some stiffness after they get up from a nap.
Okay.
Or it could be a more obvious limp, maybe intermittent, maybe persistent. Often it gets worse after they've been running around or playing.
Worse with exercise.
Yeah. But sometimes, especially in young dogs, the signs can be quite mild initially, maybe needing more advanced diagnostics if nothing obvious shows up right away. Older dogs might just have this sort of recurring lameness because the arthritis has set in.
So subtle stiffness, maybe a limp that comes and goes.
Yeah.
What would a vet find on an exam?
Well, they'll carefully check the elbow's range of motion. There's often pain when the vet flexes or extends the elbow fully,
Right.
or sometimes when they manipulate the lower leg while keeping the elbow still. You might notice the dog holds the affected leg slightly away from its body, maybe with the paw turned outwards.
Ah, that outward turn.
Yeah, it's pretty characteristic. There might be swelling, sort of a puffiness or fluid feel around the joint, especially on the outside. And in chronic cases, you might feel or even hear a grating sensation that's called crepitus, and the joint might lose some of its normal range of motion.
Okay. So we know genetics is the main driver. Are there other factors that, push a dog towards developing it?
Yeah, besides the genetic blueprint, developmental factors and nutrition definitely contribute.
Nutrition. How so?
Specifically, rapid growth and gaining weight too quickly. Particularly in these predisposed large breed puppies, high-calorie diets are often implicated.
Ah, so growing too fast puts extra strain on those developing joints.
Precisely. It's like asking the joints to handle too much load before they're fully formed and mature.
That makes sense. So if a vet suspects elbow dysplasia, based on the breed and the signs, how do they confirm it? What's the diagnostic process?
Well, first they'll consider other possibilities, rule things out. Could it be trauma,
Yeah.
an infection, some other bone issue, even cancer, though that's less common?
So differential diagnosis.
Exactly. But the key diagnostic tool is definitely imaging.
X-rays.
X-rays are the starting point, absolutely. And it's really critical, the source stresses this, to X-ray both elbows.
Both, even if only one seems sore.
Yes, because it's bilateral, remember, in about half the cases. You need to know the status of both joints.
Okay, what can X-rays show?
They can show general signs of degenerative joint disease, or DJD. Things like bony spurs osteophytes or increased bone density, sclerosis around the joint. Sometimes you see that stair step where the radius and ulna surfaces don't line up smoothly in the joint.
So signs of wear and tear, basically.
Yeah, signs the joint isn't healthy. And then there are specific views that help spot the individual problems.
Like for the UAP or OCD.
Exactly. For UAP, that ununited process, a flexed side view, a flexed lateral view, is usually best. For OCD, those cartilage flaps, you often need front-on views, maybe slightly angled, to see changes on the humerus.
And the FMCP, the fragments, you said that's trickier.
It can be. Sometimes you see secondary signs like bony changes on that coronoid process, but the fragment itself might not be visible on X-ray. So often FMCP is diagnosed by seeing the DJD and ruling out UAP and OCD.
So if X-rays aren't totally clear, what's next?
That's where more advanced imaging comes in. CT scans are particularly good, especially for FMCP, because they give such a detailed cross-sectional view. They can spot tiny fragments or fissures that X-rays miss. MRI can also be used.
Okay. Any other tests, like joint fluid?
A joint fluid analysis can confirm inflammation is present, but a normal result doesn't rule out dysplasia.
Right.
And then there's arthroscopy, putting a small camera right inside the joint.
Like keyhole surgery.
Kind of, yeah. It's fantastic for diagnosis because you can directly visualize the joint surfaces, look for OCD flaps, FMCP fragments, signs of UAP, and assess the cartilage health. It can be both diagnostic and therapeutic sometimes.
So let's say we look inside. What are the actual pathological findings? What's gone wrong at the tissue level?
Okay, so for UAP, instead of solid bone, you'd see fibrous tissue connecting that process to the ulna, plus DJD signs. For OCD, you see the cartilage flap itself on the humerus, maybe some hardening of the bone underneath it, and wear on the opposite surface.
And FMCP.
You'd find those actual cartilage or bone and cartilage fragments broken off the coronoid process, and often erosion on the part of the humerus it rubs against. Again, with DJD.
And incongruity.
You'd see abnormal wear patterns, particularly on that medial coronoid process and the opposing humeral condyle. Sometimes linear wear lines in the cartilage. And always underlying all these, signs of that progressive degenerative joint disease.
Okay, it definitely sounds like it causes significant damage in there.
Yeah.
So what can actually be done? What are the treatment options available?
Well, surgery is very often the recommendation, kind of the standard approach for many cases. Though the source does note there can be some debate about the absolute best surgical technique in certain situations.
What about after surgery?
Post-op care is key. Things like cold packing the elbow initially to help with swelling and pain. Then, once they're bearing some weight, gentle range of motion exercises are really helpful.
And rest, presumably.
Oh, absolutely. Strict activity restriction is crucial for several weeks after surgery to allow things to heal properly.
And you mentioned nutrition earlier as a risk factor. Does it play a role in treatment too?
Definitely. Weight management is critical throughout the dog's life. Keeping them lean reduces stress on the joints.
Makes sense.
And for those young, growing dogs, controlling their diet to ensure slow, steady growth rather than rapid spurts is really important. Owner education is a big piece too, understanding it's inherited, that DJD will likely progress even with treatment, and the role of diet.
Right. So what kind of surgeries are we talking about for each specific issue?
Okay, so for UAP, options include just removing the loose piece, trying to reattach it with a screw, or sometimes cutting the ulna bone and osteotomy to change the forces on the joint. The choice really depends on the dog's age, how bad the arthritis is, and the surgeon's preference.
Okay.
For OCD and FMCP, the main goal is usually surgery to remove those irritating fragments or flaps, often done through an incision on the inside of the elbow.
An incongruity. That sounded complex.
It is. Surgery for incongruity is more varied. Sometimes it's watchful waiting, sometimes removing part of the coronoid process, sometimes various osteotomies cutting and repositioning bone to try and improve the joint alignment. It's quite specialized.
And arthroscopy. You mentioned that earlier.
Yeah, that camera in the joint surgery. It's a great option for treating FMCP and OCD, allowing removal of fragments with minimal invasion. It can also help diagnose and sometimes treat incongruity too. Better visualization, often faster recovery.
So lots of surgical possibilities. What about non-surgical options? Are there medications?
It's important to understand that no drugs can fix the underlying UAP, OCD, or FMCP. They can't heal the fragments or flaps.
Okay, so meds are for symptoms.
Exactly. Medications are mainly focused on managing the pain and inflammation from the resulting degenerative joint disease. NSAIDs, non-steroidal anti-inflammatory drugs, are the mainstay here.
Like which ones?
The source lists several common veterinary NSAIDs: daracoxib, carprofen, etodolac, meloxicam, tepoxylin. They help make the dog more comfortable.
Any drugs to avoid?
Generally, long-term corticosteroids aren't recommended because of side effects and potential harm to cartilage, and NSAIDs themselves can sometimes cause stomach upset, so that needs monitoring.
What about joint supplements? Glucosamine, chondroitin, things like that.
Yeah, the source calls them chondroprotective agents. They might help slow down cartilage damage and reduce symptoms in some dogs, but the evidence can be variable. They're often used as part of a multimodal approach.
Okay, so after diagnosis and maybe surgery or starting meds, what's the long-term plan?
Post-surgery, as we said, activity needs restricting for at least 4 weeks, maybe longer, but gentle movement is encouraged once healing allows.
Right, prevent stiffness.
Exactly. And then lifelong management often involves keeping the dog lean, modifying exercise to avoid high-impact activities, continuing NSAIDs or supplements as needed, and regular vet checkups. Yearly checks are recommended just to monitor the progression of the arthritis.
Since it's so genetic, what about prevention on a larger scale?
Well, the most effective prevention strategy is responsible breeding. The advice is clear. Don't breed dogs diagnosed with elbow dysplasia.
Makes sense.
And also avoid repeating a breeding pair that has already produced affected puppies. Screening programs exist for breeding dogs in many breeds.
Okay, so screening potential parents is key. Finally, what's the overall outlook? If a dog gets this diagnosis, what can the owner expect?
Well, the reality is that some degree of progressive joint degeneration, arthritis, is pretty much expected, even with treatment.
So it doesn't just go away.
No, it's a lifelong condition. However, the good news is that the overall prognosis for most dogs with elbow dysplasia, regardless of the specific type, is generally considered fair to good.
Fair to good. That's actually more positive than I might have guessed.
Yeah, with appropriate management surgery if needed, weight control, exercise modification, pain relief, many dogs can maintain a good quality of life for a long time.
That's really good to hear. So, okay, elbow dysplasia is definitely complex and it's clearly common, especially in those large breeds so many of us adore. But it sounds like understanding it, knowing the signs, knowing the options, it really gives you, the owner, power to help your dog.
Absolutely. Early detection and the right kind of care really can significantly improve their comfort and mobility. So, if you notice any lameness, any stiffness in your dog's front legs, especially if they're one of those at-risk breeds, definitely have a chat with your vet.
Good advice.
And that actually leads to a broader thought, something for you to ponder. Given the strong genetic link we've discussed with elbow dysplasia, what does that tell us about the wider implications of understanding inherited diseases in our pets? How might that shape the future of breeding or even preventative vet care?